Welcome to Be Livable, dedicated to health condition awareness and holistic wellness. Migraine is a complex neurological condition with a genetic basis, characterized by episodes of moderate to severe headaches, predominantly unilateral in nature. These episodes are often accompanied by nausea, sensitivity to light and sound. A key feature of this condition is the intensification of headache during physical exertion. Intense odors, including those from perfumes, paint thinners, secondhand smoke, and similar sources, may act as triggers for certain individuals. The exact cause of migraines is not fully understood. It is thought to arise from abnormal brain activity that temporarily interferes with nerve signals, chemical levels, and blood flow in the brain. Around 50% of those affected by migraines have a family history of the condition, suggesting a possible genetic component. Migraines can develop through 4 separate phases, although not every individual will go through all of these stages. The prodromal period signifies the early stage of a migraine, functioning as a warning signal for an approaching headache, typically occurring 1 to 2 days prior to the onset of a migraine. Signs that indicate the approach of a headache may include heightened sensitivity to light or sound, difficulty in speaking or reading, yawing, muscle stiffness, mainly the neck, cravings for specific foods, mood fluctuations from depression to euphoria, lack of concentration, fatigue, insomnia, nausea, constipation, increased urination. There are 2 primary categories of migraine identified as with aura and migraine without aura. Migraine with aura is characterized by sensations that resemble an electrical or chemical wave, beginning at the center of the visual field and expanding outward. In contrast, migraines without aura are far more common and present symptoms that are similar to those observed during the prodromal phase. Visual disturbances can include bright light flashes, circular zigzag lines, double vision, or dark spots. These symptoms usually develop gradually, peak over a span of several minutes, and can endure for as long as 60 minutes. The headaches are characterized by unilateral pain that is throbbing and ranges from moderate to severe in intensity. The onset is gradual, and physical activity can intensify the pain. However, the effects of physical activity on migraines are complex. Although exercise may trigger migraine attacks, regular exercise might help decrease their frequency. This headache may be experienced bilaterally, affecting both sides of the head. This discomfort is generally mild to moderate in intensity and are not worsened by physical activity. It can originate from musculoskeletal tension in the head and neck or from other forms of physical or psychological stress. This type of pain is notably common among those who have migraines without aura. In adults, these aches typically last between 4 and 72 hours, while in young children, it may be shorter, often lasting less than 1 hour. Migraine headaches are often associated with a range of symptoms, including throbbing pain, dizziness, nasal congestion, nausea, sweating, blurred vision, confusion, increased urination, tenderness of the scalp, and diarrhea, which can vary in intensity. There is a broad consensus that a blend of environmental and genetic elements influences the modulation of nerve cell excitation and inhibition in the brain. Hormones and chemical agents, such as serotonin and estrogen, are often significant factors in determining pain sensitivity related to migraines. For some individuals, a decline in serotonin or estrogen levels can lead to the onset of a migraine. Food triggers can consist of items such as aged cheeses, dairy, chocolate, alcoholic beverages, particularly beer and red wine, cured meats, citrus foods, certain nuts and beans. Moreover, preservatives like nitrates, nitrites, and monosodium glutamate, MSG, along with artificial sweeteners, smoked fish, and yeast extract, It is important to note that these triggers can differ from person to person, necessitating individual identification. Among the frequently encountered triggers are stress, particular medications, inadequate sleep or modifications in sleep cycles, changes in weather, overexertion, meal omissions, and addictive substances like caffeine or tobacco. It is important to highlight that caffeine may reduce symptom severity for some individuals, yet it can also provoke symptoms in others. Identify potential food triggers. Include magnesium-rich foods such as leafy greens, kale, spinach, and collard greens. Nuts low in phenylalanine, amino acids such as almonds, cashews, and Brazil, nuts beans such as edamame, kidney and black beans, pumpkin and chia seeds, fatty fish beverages such as decaffeinated coffee, ginger, peppermint, or holy basil tea, and ample of water. For some individuals, over-the-counter pain relievers may provide relief. Cold compresses can alleviate discomfort associated with migraines. Taking warm baths prior to sleep may also be beneficial. Engaging in gentle movements, including arm stretches, wrist rotations, and shoulder and neck exercises, can provide relief. Incorporating yogic breathing exercises into your routine is advisable. Spending time outdoors, whether through walking or simply sitting in natural surroundings, can be beneficial. Additionally, if necessary, consider incorporating supplements like vitamin B12 and vitamin D. If you are seeking a personalized holistic consultation and customized plan, please reach out for more information.